So they want to know that the provider that they're seeing understands what they're going through and is specialized to be able to help them.
That actually made me think too. So let's say, new mom, right? Shows up and she's like, yeah, I need some help. And she ends up with a regular kind of mental health therapist. Is there an opportunity for them, for the therapist themselves, right? That psychologist say, yeah, I'm not really equipped for this. Here, let me send you to Phoenix Health. Do you have that in place? Is that something you're building so that you can have that kind of referral network?
Yeah, that definitely does happen often.
Mm.
Where a provider feels like they just don't have quite the skills or the knowledge to be able to help that person. And then they'll refer to someone like us who's more specialized. And we'll do the same, if we get a case, like, for example, we really don't work with eating disorders. And sometimes eating disorders do overlap with perinatal mental health. But if an eating disorder is prominent, then we're going to refer them to a provider that's specialized in that area. So kind of goes both ways. So we work with individuals and families, couples that are navigating any mental health concerns related to the whole perinatal period. And the perinatal period pretty much refers to the period between trying to conceive, through pregnancy, through postpartum, through that, first couple of years after giving birth. And there's a lot of different things that can happen in that span of time. Like you mentioned, a lot of people are impacted by infertility. And yet it's not spoken about enough. And unfortunately, a lot of people experience losses along their reproductive journey. And then even when quote unquote things go normal, there's still often some anxiety, depression. OCD is also something that's pretty common that can come up during the perinatal period or specifically during the postpartum period. Trauma, PTSD, birth traumas, trauma from infertility, from miscarriage. There's so much that can really happen. And the work that we do is we're a team of licensed mental health professionals that really specialize in working with that specific point in time for women and families. So in some cases, it will look like, a typical depression where a woman might experience a very low mood. She might be very sad. It might be hard for her to get motivated. She might have difficulty bonding with her baby, difficulty sleeping. Like even when baby's sleeping, she might find that her thoughts are racing. It often does overlap with some anxiety as well. But there are cases where, and which was true in my case, where I didn't look like any of that was happening on the outside. And on the outside, women can look like they're functioning really well. They're keeping their house, they're taking care of their baby, they're doing what they have to do. But inside, all these really dark, heavy thoughts are coming over them, and they're afraid to speak them out loud. They're afraid of being judged. Sometimes even people are scared that their baby will be taken away. I mean, they just don't know. It's a very hidden depression in a lot of cases.
Do you see yourselves trying to like maybe push to get people on the therapy before the baby's born? And do you think that that would maybe help them avoid the problems after the baby's born, maybe completely, like maybe avoid the whole depression and anxiety that comes later by having them on the therapy already when they get there? Do you think that that could help? And is that like maybe a program you can see yourselves pushing in the future?
Yeah, absolutely. I think having those supports in place earlier on, especially if you know that you're at risk for anxiety or depression, like you've had it in the past, or your mom had postpartum depression, getting in earlier and being proactive versus reactive is always, I agree, it's always, in my opinion, going to be more effective. And that is something that we definitely try to encourage and educate people on. And we definitely do have people that will reach out.
And sorry guys, but dads don't always feel that way. I don't know what it is. I think it's like our nurturing, like kind of like the things that are like physiologically built into women, of like that caretaking that I'm like, I've never seen my husband have like dad guilt. I just don't, where I have. And quite honestly, like my kids are 16 and 11. And I can tell you that it wasn't until maybe a couple years ago where I started being like, I'm ready to give time to myself and I'm not going to feel bad about leaving to go to the gym or go out with my girlfriends or, go away for the weekend, something like that. And my kids are 11 and 16. So it's like I've been living with
Took
this
a long time.
a long time. Yeah,
Yeah.
now I'm just like, I'm leaving. Bye.
There is definitely a different bond between the mother and child and the father and child. They literally, you create them inside yourself. They are literally a part of
Hmm.
you. Men don't get that. We can seriously bond with our kids and stuff, but it's never going to be the same as what the
Right.
mom has. It just physiologically can't be.
It's
Yeah.
so true.
It's not the same.
Well, that's just what came to my mind. I was thinking of my patients that have doulas. The doula will be the one that'll go above and beyond and
Right.
make sure do set up that warm handoff, or the lactation consultant. Those are
Yeah.
the ones that we typically see that are going to make sure that that person gets to your door.
Yeah. They're like so I think, doulas, we've been talking a lot about doulas on the show actually. We've done a couple of episodes now. I love that there is like the rise of the doula is it's no longer like this hippie tree hugging thing. Yeah, anyone, I don't, no matter where you live, doulas are great. It's such an, I think, looking back, I wish I had one, you know,
Me
and
too. Yeah. I mean, I had my kids 7 years ago. I don't even remember doula being something that was talked about at that
no,
time.
never. Yeah, but now
Never even heard the word till episode 10 of this podcast.
Jeremy's learning a lot.
I'm
Yeah,
sure.
yeah. So, yeah, they're like such a, to me, if you don't have one, like you're missing out, right? Like, go.
Thanks for joining us on the Healthcare Uprising. Make sure to hit those like and subscribe buttons before you go, and take a moment to think of a friend and hit that share button. You can find us on all the major audio platforms, and we've got video on YouTube and Patreon, patreon.com/healthcareuprising, if you want to watch us in action.
You can also find us on social media on LinkedIn, Blue Sky, Instagram, and Facebook. Just search Healthcare Uprising to find us. And if you're a new company or a creator with a cool new product for the healthcare space, or if you're someone with a personal healthcare journey and you'd like to share it with us here at The Uprising, please email us at healthcareuprising@gmail.com and we'll get back to you about coming on the show. That's all for this dose of Healthcare Uprising. Till the next time, keep looking for the good in the world, because sometimes it's where you least expect it.
This has been a Shut Up production.
Shut up!